Dante lives alone and his walks are everything. His walks are his fitness, his helps with his mood to stay in a good mood like exercise does. And this altered it back to where he can do that again. And that's what's really important, is that he can do his walks and live alone, which is important to him. We went to 2 before this, and we wasted 2 weeks. This is the difference that we found with Orlando Orthopaedic and Dr. Obi and the staff. Cindy, the manager, Sarah, the patient coordinator. They were immediately involved, immediately scheduling, and number one, above almost everything, returned calls quickly, answering the questions that we had, which helps a lot. We were really nervous about where this was all headed. So that would be the main thing, is just their promptness and thoroughness. Yeah, well, my name's Langdon Stanley. This is my brother, Dante Stanley. I'm his guardian. And back December 29th, 2020, we were out in the country, out by Geneva, four-wheeling and motocross riding. And unfortunately, my brother met with a tree and it didn't move, and broke his kneecap. At the time, I didn't know if the injury was worse, so we called an ambulance, went to the ER, and then we eventually hooked up with Dr. Obi. When we came to the office, immediately right in the hallway were hand sanitizers before we even touched the door. We came in, everything was social distancing properly, and we felt completely comfortable with all the protocols that are supposed to be in place. So we were completely comfortable with any of that.
Hey everyone, I'm Dr. Adigweme. I'm a board-certified orthopedic surgeon with the Orlando Orthopedic Center. I specialize in hip and knee surgeries and orthopedic trauma. In Dante's case, he came in with a displaced patellar fracture. Your patella essentially helps you extend your knee, so he was unable to extend his knee and had very significant difficulty walking. So in that scenario, when you're unable to extend your knee after that injury, that requires surgery. So we took him back to surgery. It was an outpatient surgery. Essentially what we do, it's maybe about an hour long. We just put the 2 pieces of the patella back together, put 2 screws in, and then kind of cabled across the fracture. And then he was in a brace for about 6 weeks while it healed. And now, as you could see, he's able to extend his knee and walk again.
When we first met Dr. Obi, we were very impressed with how he wanted to listen to what we had to say, what happened, and how he was going to help us, and how he was going to work with his schedule. He was easy to communicate with, and we were just real comfortable that this was going to get handled by someone of his, knowledge. We're just really appreciative of Dr. Obi, his staff, and the Orlando Orthopaedic for taking care of my brother at a time where we weren't even sure if we were going to get this operation done in time without further damage being done, and they did that for us.